All right, so let's talk about herpes. Okay, this is another virus that's sexually transmitted. It's what we call herpes simplex virus. There's two types. Okay, actually there's 6 different types. Chickenpox is one on there, and a few other ones. There's a few other ones on there, but we're just going to talk about the first 2 subtypes, which is what's dealing with sexually transmitted ones on there. But we have herpes simplex virus type 2, herpes simplex virus type 1. Type 2 is the one that's more prevalent in general cases, right? About 2/3 over there, and about 1/3 is HSV type 1. Does that matter? Not really. How they're getting that? Well, HSV type 1 is usually what's causing the fever blisters or the cold sores that many people get on their mouths. But keep in mind, as I mentioned before, oral sex is a pretty common thing that people do. So if there's a fever blister here, it's not unlikely with doing oral sex that you're going to get herpes simplex virus type 1 down below. All right? And vice versa. They could get type 2 up here because of the oral sex. So keep that in mind, all right? Does it really matter? No, it's treated the same way, okay? But if you go into the research stuff, that's where that comes in. All right, statistics, 5% of people report symptoms. About 30% are positive with no symptoms. I feel that this 30% is much higher than that, okay? Because, again, 5% of report symptoms. How are they getting all these numbers? I mean, if you're not going to see the doctor, how can you be a statistic? How do they know if you have it or not? Does that make sense? So keep in mind, most people with all these sexually transmitted diseases don't really get them. It's dealing with their sexual organs, so they're a little embarrassed about it, and people looking at it and whatnot. They're not so. They're scared, right? Of what that means to themselves, let alone to their wife or to their husband or to their family, for that matter, what's going to happen. So keep that in mind, all right? The way you can get herpes over here is obviously sexual contact, tactile. Now these are, as we talked about with in skin, we talked what vesicles are. Vesicles are basically little blisters, small blisters. So there's fluid in there. The fluid is where the HIV, or where, I'm sorry, not HIV, but where the herpes is. So if there's vesicles, they're contagious, because if you rub that vesicle and it bursts, that liquid holds a lot of the viruses. That's what goes in. It's surprising, but when the vesicles are gone and it starts forming a crusty-like layer there, it looks actually more nasty than with the vesicles. But believe it or not, when it's a dry, crusted skin lesion over there now, that's when it's not contagious, but yet it looks really bad, right? So you could get, if the skin lesion is oozing, you can get this also, right? Also the vaginal canal, all right? So we also have the perinatal period where if we see vesicles in the, these vesicles, herpetic lesions, vesicles, in the vagina, then the baby, when it comes through the vagina, they can get it too, right? Because you're going to, as the baby comes through there, you're going to traumatize those vesicles. They're going to open up and start oozing, and now the baby's got on his face, taking it in its mouth and whatnot, okay? There is a small percentage, okay, where less than 1%, this can cross the placenta barrier and goes to the baby too, all right? Very small percentage. We usually see the upper 3 cases happening more, okay? So symptoms, like most of the sexually transmitted diseases, asymptomatic. They don't even know they have it. If they do have symptoms, you're looking at flu-like symptoms. You just get malaise, very tired, you get nauseous, maybe diarrhea, some fevers, all right? Just something that you wouldn't associate that with herpes, right? If you see it though, it could be burning, all right? I think most of us have had cold sores before, so you know what it's like. It's nasty looking, but you get the pain and stuff on that. So you have these herpetic vesicles, as I mentioned before. They can evolve into very painful This is not the same thing as what I talked about with stage 1 syphilis with the Chancard. Now keep in mind, that's a painless ulcer. This, when this tears, these are painful ulcers. Different situation there, okay? And they take, like chickenpox, it takes about up to 3 weeks before they actually heal up completely, okay? If the baby goes through the vagina, you can also get neonatal herpes, and they can cause blindness with that, okay? And the diagnosis is pretty obvious. When you see, I'm going to show you the pictures, you're going to see these vesicles, these little dotted blisters. It's pretty obvious. But if there's question about what it is, they'll do a serotype in the blood. So we'll do a check for antibodies for this virus. It's a blood test that they will do. Okay? The way you treat this is viruses, or antiviral medications, something called acyclovir. Now keep in mind, viruses, once you have a virus, you can't get rid of it. It usually goes, it hides away for some time and then comes back when the immune system goes down and so forth, like chickenpox, so to say. So this antiviral medication is not going to make it, you're not going to cure it, because this is not curable, okay? Once you have it, you have it. It's one of those things that it's a gift that keeps on giving, right? You have it, you have it. What this medication is going to do is just decrease the symptoms of it, right? So it's going to decrease, instead of having it frequent, maybe because they come and go. They could appear and then not appear for, let's say, 6 months or 6 years, and then it appears again. But if you're having frequent bouts of it that they're just appearing like every 3 months or 6 months, this medication will make that the periods in between a little bit longer. So it only helps with the symptoms, okay? But do keep in mind, we check every woman who is in labor, who has a history of herpes. We will look in the vagina before we decide the baby to go through the vagina, all right, vaginal delivery. If we see herpetic lesions in the vagina at the time of labor, she is not to have or we explain to her, she should not have a vaginal delivery, okay? That's what I'm saying over here. The vagina must be examined prior to the vaginal delivery. If there's herpetic lesions there in the vagina, then a cesarean section. You're going to bypass the vagina. You're going to cut over here, get the baby out that way, okay? To bypass that, because we don't want to have it to go to the baby. Chlamydia, like I said, we could put some cream on the eyes. Does that make sense? But for herpes, it's a virus. We don't have a medication for that. Once they have it, and that can cause blindness. So do keep in mind that if we see herpetic lesions in a woman in the vagina, just, woman comes in, she's in labor, we look in the vagina, we see herpetic lesions, we tell her we do not recommend, and most women, if not all, they are concerned about the safety of the child, they will have a C-section. But again, this is going to be a can of worms. And just think about this, all right? Easier said than done. Here's a woman that comes in, says that, shows that she has signs of herpetic lesions that are there, and now she's going to have a C-section. So, as always, the family, the mother, her mother, her mother, her parents, her grandparents, aunts, are like, oh, she's going for a C-section. What's the first question that they have is if you're going to go for a C-section? Why, right? Fetal distress, right? Or baby's too big to come through. But now you have to say, well, I got herpes. You see? So it opens up a can of worms. Now maybe, you got to figure out, that's where you as a nurse are going to need to talk to the patient and say how, as a nurse, we can't, through HIPAA, we can't really talk to your family members about your condition. We just, as nurses, nurses are medical professional, we just say, talk to the patient and talk with her. But sometimes, they go under a lot of stress. So that is somewhat easy, but it gets harder. But what happens, let's say, the husband comes in and realizes that she needs to go for a C-section, and yet she didn't tell her husband that she has a history of herpes. So now she has to explain to her husband why she has a C-section. You see, it's not cut and dry for this. All right. That's why one of the reasons why I like being a gynecologist, I get to know the patient more than her own husband. Does that make sense? I mean, I need to know, not I get to know, I need to know if she had any sexually transmitted diseases in the past, any miscarriages, any abortions in the past, you know, all these kinds of things that she may not want to choose to tell her own husband, or a partner for that matter, right? So I need to know that because it's going to help me to figure out what to do with her particular condition, right? So anyway, just want to say that you need to know that if you see herpetic lesions in the vagina at the time of delivery, she's to go for a C-section. Now, if she doesn't, and I've never had that situation, but if she doesn't, then she has to sign against medical advice, and if the baby gets it, we should be all cleared. But it's easier said than done. Right? Just letting you know about that. Okay? All right, so let's look at some pictures here. Okay? So these are herpetic lesions over here. If you see, it's like small little blisters. Okay? That happens. Now this may be on the skin or over here, but I'm talking about down below. So this is just, I just want to show you what a vesicle looks like. Okay? And it kind of, you know, it looks just like chickenpox because it's in the same family. Chickenpox is a herpes virus. Okay? Just acts a little bit different. So this is what it looks like on a penis. All right? And if the if it occurs on the vagina, and a lot of times it's inside the vagina, you can't really see it unless you put a speculum inside. But sometimes you can see it if you spread it open. You may see it over here, or it might just be in the perineum, or by the anus, or just outside, someplace on the vulva. Okay. So that's where that comes in. Now the next picture here, yeah, that one's pretty bad. All right. This is a woman that was a prostitute. Okay, one of my not my prostitute. It's one of my patients. Believe it or not, this is a woman that that just had intercourse the night before, and she was in a lot of pain. I guess she needed to get her money or whatever she had to do. And she was in a lot of pain. I don't know which was worse, her, because she had to withstand that pain when she was actually having the intercourse, or him. I don't know what kind of monster he was to actually want to have intercourse with a woman like this. That's why you need to look at what you're going to be doing, you know what I'm saying? Anyway, so she had intercourse the night before. She was in excruciating pain. She wanted her drugs. She was a prostitute that did heroin and stuff. But she, after make a long story short, after about like, I think I did it in about 6 to 7 days, we cleared this whole thing up. We put a lot of cyclovir, that thing that cuts down on the symptoms. We did it through the IV. So she actually did wonders after about 6 or 7 days. She was so happy. She wanted to hug the IV, you know, that kind of thing. Yeah, so we actually cured it. But of course, you know, I'm sure she went right back to what she needed to do. And I don't know. She never followed up with me. This is when I was working as a resident, but she never followed up with the family practice and stuff. So, but that's better. Okay. All right. AIDS. Again, this is due to the HIV virus, right? The immunodeficiency virus. And the way this works is that this virus is going to decrease the immune system's activity by destroying, attacking and destroying the helper T cells. Do keep that in mind. It causes AIDS over here. So I don't want to spend any time on that. We've already delved into that pretty deep with it. So just review that for your final exam, and that's where that is. Okay. All right. The last one I want to talk about is this. All right. This is our only parasite that we need to be concerned about when dealing with sexually transmitted diseases. This is Trichomonas vaginalis. That's the name of the protozoa. The disease that it causes is trichomoniasis. Okay? Some people refer to it as trick. You have trick, that kind of thing. Okay? But it's a protozoan. That's what these little critters kind of look like. And you see them swimming around. It's pretty nasty when you look under a microscope at these little guys that are actually swimming around in the vagina. It's a very, very common sexually transmitted disease. The way you can get this, the only way you can get this is sexually transmitted. Okay. So just a few things on this is it's asymptomatic, very similar to chlamydia and gonorrhea. Do keep in mind you have this. If you have symptoms, you may have this yellow, green, or whitish that happens. One thing to note is usually it becomes a very fishy odor. Not all the time, but if you see a yellow discharge and you do smell it, it has this like fishy odor. It can cause dysuria, painful burning when you pee, dyspareunia when you have pain during intercourse, or for a guy, you may also have pain upon ejaculation. The area becomes very itchy, the vagina, the penis. So those are what the symptoms may be, but most cases we're looking at an asymptomatic situation. Complications we're concerned about is in pregnancy, okay? Usually, if there's this parasite that's in the vagina, it can ascend through the cervix and go into the uterus, and it can thin out that membrane, right, the amniotic sac around the baby, and could get it very thin and make it burst. And that can cause premature rupture of membranes, right, breaking your water, so to say, at an early stage on there. It can cause preterm labor, preterm delivery. We do see that happening. If they do get born early, we're going to see that there's going to be low birth weight in the newborns. Also, too, is that even if we treat the baby, the mother's not out of the clear yet because the uterus just came out. Keep in mind, that placenta just came off, so it's got a raw area inside the uterus, right? So there's open blood vessels there. That's all raw. That's a great place for bacteria to actually get to, or in this case, protozoans could get to and infect that whole area. And that could cause your endometrium being inflamed. So we call it endometritis. That'll cause fevers and stuff. Okay? The way you diagnose it is we just do a culture, and this is curable. We just give a certain antibiotic called metronidazole. The trade name for it, you might have heard of it, is Flagyl. Okay? The reason why they call it Flagyl is because it takes care of protozoans that have a flagellum, and that's how they came up with that name, Flagyl. But it's metronidazole. Okay? All right, and got him as our mascot, right? Now, be afraid. Be very afraid if you walk in and see this guy as your patient. Okay.